I'm Hilary Gardner and I'm the Strategic Liaison Nurse for Adults with a Learning Disability in Hertfordshire. This is a short video to help clinicians, mainly in primary health, to understand what the content is of the new purple folder. We have relaunched the purple folder, which is the passport for health for adults with a learning disability, and ensured that the content reflects exactly what clinicians need to help reduce that risk of delays in diagnosis and reduce that risk of diagnostic overshadowing. Working with someone with a learning disability is a team effort. You need that core understanding of what that person's baseline is and how to overcome barriers to ensure that you can meet their health needs. And that's the aim of the new purple folder. So what I'm going to do now is just whiz through some of the key pages. So when someone comes into your practice and presents their purple folder, you know what to look for in there that will help you to reduce those risks. Okay, so the first significant point is on the vital information pages, which is the first couple of core pages. There doesn't just refer to a person's next of kin, but also significant people in their lives. Because it's really, really important to remember that somebody's next of kin may not actually be the person who will be able to give you the core information about who that person is and what their best wishes would have been had they got capacity where somebody doesn't have capacity. So please make sure you check out who are the significant people in that person's life, not just their next of kin. We have also added in that core vital section some details about vaccinations so you can see at a glance what vaccines they have. This is so you can look opportunistically. Often when working with someone with a learning disability who has a reluctance to have vaccines, we may end up battling to get one particular injection into a person or one particular blood test when we need to look opportunistically at what else we can cover at those times as well. So it's that quick glance to sort of say, what else could I do while I'm ordering this blood test or while I'm ordering this, trying to overcome a barrier to this injection. The next key page is the reasonable adjustments page. And what we're asking is people who know the person best to note down those core things that help the person overcome their barriers to accepting health treatment. So the things listed here should be very specific examples of things that have previously worked. So that could be something like, let him wait in the car park and then bring him in when it's time for the appointment, or, give him a high five at the door, or talk about dogs for 2 minutes before you start talking about health, because that'll help him relax into accepting you and trusting you. Those sorts of things should be on that. Now, you also work with these people for a long time. So if you look at that section and you think it doesn't reflect those little beautiful nuggets that you've learnt about a person, where you know that when Bob comes in, if I ask him how his train collection is, will mean he instantly relaxes and engages with you. Make sure that you tell the people in that person's life to make sure that's on there as well. Because remember, your nuggets, where you know how to work with someone, are also key when it comes to the person going to someone else for healthcare. So don't just read this section. Make sure that you, as the clinician, with all your beautiful nuggets of knowledge, also have got that down, so that should you leave the service, the next primary health clinician can also offer them the same service that you can. The next key page is the communication page. Remember, under the Accessible Information Standard, we all have a duty to ask, use, flag, share and record a person's communication preferences. So that's not just, that he speaks verbally, that's those core elements such as he lives independently and he's renowned for throwing letters away, and he's given permission that every time you send a letter to also send it to his sister, because she'll nag him and make sure he follows the instructions. Just think, if you don't have that recorded and used, then that could mean that the person doesn't get that healthcare they need. Also in that communication, it's those core things like we talked about before, about if you need to talk about trains for 2 minutes to help the person relax, make sure it's recorded as an accessible information standard and shared when you refer on to other clinicians. So again, this section isn't just about reading if you don't know the person well, it's about checking if you do know the person well that this is accurately reflective. So again, it's a legal requirement. The reasonable adjustment section under the Equality Act, you have a legal requirement to follow someone's required reasonable adjustments. So the same under communication. So please just make sure you double check it, because those barriers to accepting healthcare might have the answers on that page. There's also a small section called Known Barriers, Fears and Phobias to Health Investigations. Again, double check this, because you might be just hitting a very strange phobia the person has. For example, I once worked with a guy who had an absolute fear of birds, and the doctor, whilst the person was in the room, referred to putting something in his pigeonhole. Well, the guy turned the whole of his practice over, absolutely lost it. So it's about those known fears, because often, you know, you're unaware of what's around you in your room. So there may be what you deem to be insignificant things, but they may be really significant to that person, such as paraphernalia relating to blood tests or blood pressure machines. So just make sure that you know if there's something triggering them that you are unaware of that's already active in your room by double checking that known fears section. And again, if you know the person's got a known fear and it's not been logged down by the people around them in their purple folder, please tell them, because the folder's only as good as those that complete it and those that use it. So we all have to work as a team to ensure it's got the right information in it. The next section that's really significant, especially for delays in diagnosis, is the section called Signs of Me Being Unwell. Remember, someone with a learning disability may not be able to verbalise, but also may not present in a typical way for somebody who's in significant pain. So what we don't want is you unwittingly treating someone's behaviour rather than their pain. So this is where we've asked people to record really clearly known things the person does when they're in pain. Because if the person is known to turn over furniture and become angry and bite their hand when they're in pain, and they present to you and you're saying, well, actually I can't get near them because they're aggressive today, then actually that's about a delay in diagnosis and ensuring that you actually sort of instantly say, yikes, he's telling me he's in pain, what can I do, what does he need, to ensure that we don't end up with, you know, avoidable deaths because of a delay in diagnosis. So do check, what do I look like when I'm in pain, what do I look like and act like when I'm well, so that you can get that benchmark as to what the person is non-verbally telling you. We now have a page with baseline measurements on, because again they can be quite significant. So it's important to know whether there's been significant weight loss, whether there's been a change to their blood pressure and pulse and respiratory rate. So we've put those down and asked people at home with the person to try and just at least annually or sort of 6 monthly keep that record, because again that could be a measurable outcome for you on delays in diagnosis, because there could be a significant change that's not been noted. So just double check what's going on with their baseline measurements that you may not already have recorded within your practice. The annual health check section now has a page for each year to evidence when the person had their annual health check, and there's a pocket to put the annual health check action plan in. So remember that that is an essential part of an annual health check. And as an absolute baseline, if somebody else has no other actions, the Stay Healthy at Home checklist should be something that the person has to ensure that the people at home are working with them to reduce that risk of delays in diagnosis by understanding those core things that are health indicators, such as checking your skin and knowing your wee and knowing your poo and checking your boobs and checking your balls, and all those elements are within that Stay Healthy at Home checklist. We'll put a link up, so please make sure that that is the absolute baseline for everyone for their annual health check action plan, and that it is evidenced and put in the folder. So that's the core information, and then we still have exactly the same as before, the health appointment record, and we still need you to record just one sentence to say what the person has been for. Remember, this again helps create that holistic picture, so any health professional they're visiting can see if they've been to the optician, the dentist, is there some mental health issue they've been referred for. You instantly at a glance can start looking at the whole picture when someone comes with certain symptoms. So please make sure you continue to use that. But also, in addition to that, we've added an additional page called Your Health Plan After Today's Appointment. There should be in the person's folder some blank ones of these, so that if there's a whole array of things that they need to do after they've seen you, you just record that on there for them to follow up. So that is especially important for somebody with a learning disability who may attend your clinic without someone supporting them with them who can retain all the information, so that you can just record in language they understand exactly what they've got to do. So I'm giving you antibiotics, you've got to take 2 a day, 1 in the morning and 1 in the evening for 7 days. If you still don't feel well, give me a call, at the practice. So that's what's on this core information sheet. It's just to help them make sure that they follow up on what was said. So again, it's down to accessible information standard. Does this person need that information to be able to follow on afterwards? And do they need it with evidence so that they can take it home and ask someone to help them to make sure they follow up? The next additional page, which some people may have completed, is a page called Reluctance to Accept Blood Tests and Injections. So this is a really vital page, as what we've asked people to do is to record how previously it's been attempted, their level of understanding previously to be able to assess capacity, and what has been used to overcome the barriers. So that when you are now faced with trying to help someone with a learning disability face a blood test or an injection, you can pull on that historical information and make your mental capacity assessment easier by looking at historically how they've been able to process that information, and also your best interest decision easier by knowing how historically they've been able to overcome barriers. So please check that page, and if again you're facing somebody who's not been able to tolerate blood tests, ensure that page is completed to build that core information. And finally, a significant page for you is a page we've created called Support with Help Assessing Mental Capacity for Specific Health Investigations or Treatments. So when you need somebody to have a treatment or investigation and they're reluctant to accept it and don't have that core understanding, you need to ensure that you have done a mental capacity assessment and acted in their best interest. Now, this is very challenging for you within the practice, so sometimes it's really important to ask the people who know them to be able to work with them at home to overcome their barriers by helping them understand what is needed, and more importantly, why it's needed and what the risk is if they don't have it. So what we've done is create a page where you would log what the person needs, why they need it, what the risk is if they don't have it, and how urgent it is. So how much time those people in that person's life have to look into that before they come back to you. So then the carers can go away and, using their skills and knowledge of the person, try and help the person understand what you want them to go through, what investigations they need to have. Then they bring that back to you for you to then ascertain whether they have capacity, and if you believe they don't, to make a best interest decision to how to overcome the barriers. So we've created this because we've had this situation where health professionals have said to carers, well, you need to check their capacity, and carers have said, well, no, that's your job to check their capacity. So what we've done is try to create a tool where you work in sync with this. It is the health professional's job to assess capacity, but it is the people who know them well more likely to help them understand. So you are going to assess capacity, but giving the people who know them well the information that they need to try and help them process to be able to understand. So it's a tool to work together to ensure that there's less risk of delays in treatment because of capacity and because somebody is reluctant to accept investigations and treatment. There is more to it in the folder, but they're the pages I just want you guys to be aware of that you can use and ask the people in the person's life to use to help bridge those health inequality gaps. So, it's about working together. If the folder arrives to you and there's not enough information in it, please ask the people in their lives to, fill it in better and give them the tips of what you want to go in it. And again, call us if you think it's a care provision that isn't doing the job well enough, and we can support them to help make sure those folders reflect what you need to know. Equally, if the person comes in and doesn't give you the folder, ask for it. Say, I need that. That's my critical information. It's about working as a team. And when someone doesn't have a folder and doesn't bring it in, again, asking them to get one and explaining why it's so important. Everything we create is only as good as the people that use it. So please use it well, and please tell us when others aren't using it well, so we can all work together to get this to a level where it's a valuable asset for you and the person and bridges those health inequality gaps. Thank you.